the facets are, and you're going to palpate movement. You don't think so? Not going to happen? Segmental motion. I once was you. I didn't believe it. But you will one day feel motion. Unless you give up. So here's what you got to do. You're going to do exactly what you did before, except you're going to put your fingers on the articular pillars. So the first thing you have to do is find the bumps and grooves that make up your articular pillar. So on yourself, what I'd suggest is you find your sternocleidomastoid up just inferior to your mastoid process. And then you're going to go deep, so you're behind it, posterior to it, and you're going to just passively run your fingers up and down. And again, it's not poke, 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 poke to try to feel it. It's gentle pressure, and then you're just going to glide up and down. So sink in. You feel bumps and grooves. Are you getting the pictures on their faces, Heather, as they're doing this?
I'm not.
It's not easy, and it's not easy to feel in your partner, but that's the first thing you're going to do. Then once you think you have something that feels like a bump or a groove, you're going to put your finger on it. Once your finger's on that area, you're going to side bend the patient's head just until you have movement at that segment. Okay? So if I'm feeling upper cervical segments, say C3 on C4, I'm not going to go all the way to the side and all the way to this side. I'm going to do a small amount of movement that arcs towards my finger. Okay? And then as I move down to lower segments, and I'm palpating, my arc gets a little bit bigger. Okay? So a small arc for upper movement, and then a much bigger arc for lower segment motion. Okay?